Let's discuss probiotic side effects, what they mean, and most importantly, what you can do if you experience a side effect, because not all reactions, not all side effects are the same. Some are actually an indication that they're working. Others are an indication that you should modify the protocol. And within nearly 10 years, I've been using probiotics as something we have nearly every patient on in our practice. I've developed what I think is the most effective troubleshooting protocol, if you will, that you can use to circumvent reactions. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health, exploring the importance of nutrition, lifestyle, and gut health through conversations with experts, research reviews, and personal stories. We break through the bias and the noise to bring you simple, trustworthy information that matters. Now, regarding probiotics, it would really be a travesty if you jump ship from trialing probiotics prematurely, which understandably happens in some cases because people have a reaction, they don't know how to account for that reaction, and they just stop. The thing I find the most helpful and the most hopeful here is there's a long history of observation of people being healthier who consumed probiotics. Whether it's Henry Boulard's observation in the 1920s that people consuming fermented teas with Saccharomyces boulardii probiotic had less cholera-induced diarrhea, or Metchnikoff, who discovered that Bulgarian villagers who consumed fermented dairy had a longer life expectancy. Again, there is a wealth of observational data from the past showing us that those who consume probiotics are healthier. And now, modern day, we've been able to isolate many of these compounds, put them into probiotic formulas, and we're seeing a growing amassment of randomized controlled trials demonstrating anything from cognitive benefit through reduction of leaky gut when utilizing probiotics. So let's recap what the most common side effects are, what you can do about them with this protocol that I've been developing over about 10 years or so. Regarding probiotic side effects, not surprising, gastrointestinal side effects are some of the most common. It could be constipation, diarrhea, pain, bloating. Skin reactions have also been documented, and not much, at least in the published literature, has been documented beyond that. However, I think the most important factor here to bear in mind is really timing. Because people are unique, you might see any type of reaction that correlates with the introduction of a probiotic. I've even seen people react to vitamin D, right? So someone can react to almost anything. So in my mind, most important to look at, I was feeling a certain way, or I have certain symptoms. I start a probiotic, and then all of a sudden, these symptoms get worse or new symptoms occur. Again, it's the timing that matters. It could be my bowels are all of a sudden loose, or I have discomfort, or maybe I have a headache, or maybe I have a skin reaction, or maybe I have this weird joint pain, or maybe I can't sleep. And this is because while the randomized control trial studying probiotics are able to detect some signal of reactivity, they're not set up with questionnaires that ask every possible perturbation of reactions. And so probably the most important to look out for is the timing matches. This is also why it's important not to start too many things at once, because then you don't know what of the few things you may have started are leading to the reaction. So timing is probably the most important. Okay, so just briefly here, let's look at what some of the good evidence, good studies are documenting regarding the incidence of probiotic side effects. Maybe the most compelling point here, meta-analysis from the journal Alimentary Pharmacology and Therapeutics, meta-analysis again of 36 randomized control trials looking at over 4,000 patients. So a pretty good examination. And they found no difference in side effects between placebo and probiotics. Placebo 17%, probiotics 19%, a non-significant difference between groups. Now again, this is not to say if you've taken a probiotic and had a reaction, this means that's not valid. But what it is meant to hopefully portray is that reactions to probiotics are rare. And this is what I want to weave into the protocol. But the first thing we should understand is that if you do it right, most everyone can tolerate at least one probiotic. And I just want to quote one additional paper, a systematic review. 43 studies found no relevant difference in safety between 37 specific probiotic treatments and placebo. Again, not to discount if you have had a reaction, but to help you to understand that they're fairly rare and hopefully give you some optimism that with the right troubleshooting, you can get to a protocol that you tolerate. One of the things that helps us understand where reactions come from is understanding what probiotics do. And this is where we've discussed a few times on the podcast in the past, this wonderful seminal meta-analysis finding that probiotics can reduce leaky gut. But in this paper, they have this great schematic. And what they're showing you here is that probiotics of various types, and we'll detail this as part of the protocol troubleshooting in just a moment, but that these probiotics can restore what they're terming here microbial homeostasis, whether it be correcting a disruption, dysbiosis, or remedying overgrowth, SIBO, small intestinal bacterial overgrowth. The ecosystem of bacteria and fungi can improve with the use of probiotics. As a byproduct of that, the barrier of the intestine becomes healthier. And that's what you're seeing here, a healthy barrier as compared to a worn down, leaky barrier. And when this barrier leaks, you have leakage of endotoxin, aka LPS, fragments of bacteria. You have inflammation, various cytokines. And of course, you have intestinal permeability, as can be measured by zonulin amongst others. But this cast of items are what the probiotics are remedying. Dysbiosis, SIBO, the barrier, the immune system, and inflammation. And this is where some of the reactions occur. So tying this to how the mechanisms lead into the types of reactivity, in my experience, my estimation, there's 4 causes of reactivity. Die-off, meaning as the imbalance is being rectified, you feel tired, flu-like, headachy. Important note here, this is usually temporary, not lasting beyond a week. So die-off is one. There could be a probiotic reaction, meaning to the probiotic itself. So coming back to this last diagram here, early stage, when the probiotic is trying to do the healing of the leaky gut, molecules get through and trigger the immune system. And for some people, certain types of probiotics may trigger the immune system to react, whereas other types don't seem to trigger the immune system to react. And this is, again, the protocol that we're working toward, but I want you to first understand the types of reaction. So it could be the probiotic itself. It could be allergens. Some probiotics have egg, some have dairy, and some are high in other excipients or fillers or colorings or flavorings, especially for getting something like a gummy. So it could be allergens. And also, some probiotics have an abnormally high amount of prebiotic. A small amount of prebiotic is okay. And I see a lot of people who get scared away from just a dusting of, let's say, inulin. That is not a problem for most. We'll discuss in a moment that if the contents is 3 to 5 grams or less, you're very likely to be okay. But some probiotics are technically what's known as symbiotics, blends of a clinical dose of probiotic plus a clinical dose of prebiotic. And this can be a problem for some people. So die-off, the probiotic itself, allergens, and prebiotics are the 4 main causes of reactions. Now, the key thing here to also bear in mind, again, die-off is temporary, up to a week. The probiotic itself also tends to be temporary, but this may take a couple of months to improve your tolerance. The same thing regarding allergens and prebiotics. As the gut heals, it is better able to digest and tolerate probiotics, allergens, or prebiotics. So it's important to keep this in mind. And again, we'll weave into the protocol. Essentially, start with the formula that you tolerate And then once you do, you can add in other probiotic formulas to accrue even more benefit. This is very similar to what we see with elimination diets and with low FODMAP diets. The general recommendation is contract down to foods that you tolerate. As your gut heals over time, you can expand your diet. Same thing holds, at least in my clinical experience, for probiotics. Hey everyone, if this video is helpful, please comment. I'd be curious what sort of reactions you've had, if the protocol that we're going to go through will help you, or like and subscribe. Really helps us get this information out to more people who need it. I just briefly wanted to share here a study from Pediatric Allergy and Immunology to quote, "Probiotic compounds may contain hidden allergens of food and may not be safe for subject with allergy to cow's milk or egg." So we want to bear this in mind when selecting a formula, but also keep in mind additionally that with improvement in gut health, people's tolerance improves, and therefore they might be able to tolerate a formula that they reacted to on day 1, on day 60, 90, what have you. The other thing I wanted to cover here, just to give you the evidence, is a meta-analysis that concluded, and I'll quote, "There was no significant effect of prebiotics on IBS symptoms." Sometimes the healthcare consumer gets marketed the mechanism of prebiotics, feed bacteria, feed the good bacteria, therefore good for you. However, as more and more study is being performed, we're seeing that prebiotics are actually not that beneficial. And if we combine that with a different study from the Proceedings of the Nutritional Society, they found that 3 to 5 grams per day might be helpful, but when the dose was higher than that, there was an increased level of flatulence and abdominal pain. Hence my recommendation to make sure you keep the level of prebiotic in your probiotic to 3 to 5 grams or less. Some is going to be okay, and you don't want to limit yourself to absolute zero on prebiotics because that will make it quite difficult to find a formula. You just want to be careful not to have above 3 to 5 grams. Okay, and then there's a few misconceptions that I think are really helpful for the healthcare consumer to understand. Because when you have a reaction, it can be unpleasant, unsettling, scary, and this is where marketing claims or internet dogma can lead you to chase down a solution that you don't need to. The first is histamine. Histamine content of probiotics does not appear to be an issue. And I want to quote for you here from Frontiers in Pharmacology: "Reduced histamine release, symptom scores, and IgE levels," this is a immune reaction, immunoglobulin, "were associated with VSL3 treatment." VSL3 is a probiotic. So by using a probiotic, reduced histamine, reduced symptoms, and reduced immune reactivity were all found. And I've been saying for a while that whilst probiotics may contain a small amount of histamine, they actually have a net antihistamine effect as evidenced by this trial. Another misconception to be aware of is probiotics feeding SIBO. Just in brief here, 2017 meta-analysis from the Journal of Clinical Gastroenterology, looking at 18 studies. To quote, "The SIBO decontamination rate or cure rate achieved with probiotics alone was 53%, which was comparable to that in a meta-analysis on antibiotics of 51%. So probiotics are about as powerful in remedying SIBO as antibiotics. Probiotics do not feed SIBO. And then one additional trial that was really seminal, they found that in people with IBS symptoms and who tested positive for SIBO, there was a 71% improvement in symptoms compared to people with IBS symptoms without SIBO only had an 11% improvement in symptoms. So you literally have better results in your gut health if you have SIBO and use probiotics as compared to if you don't have SIBO and use probiotics. So please, please, please don't make the mistake of thinking that probiotics will feed SIBO. Ample data, thankfully, to answer this question. Another recommendation I've come across which I think is understandable, but is actually incorrect in my opinion, is to use a heat-killed probiotic. And without going too far into the weeds, there is evidence, we've discussed in the past, this meta-analysis by Zorzella and colleagues, that found heat-killed probiotics were about as effective as intact probiotics. But there was no difference in side effects between groups. So even though in theory, it was an interesting hypothesis, well, maybe if you're reactive, use a heat-killed probiotic, that doesn't seem to be borne out by further study. Two final misconceptions, and again, these matter because you can get pulled into specious marketing claims. Strain. You need to use a certain strain because that's what will ensure you don't have side effects. We found no research showing side effects of differing strains. So it doesn't seem to matter regarding strains and them having higher or lower side effects. And then the final point of misconception is enteric coating. This is the special capsules, and when you go to a probiotic page, you'll see all this hubbub about protect the probiotic from the acid, and you want to make sure they get into the colon. Again, understandable, but it's really a misconception when we understand that the large intestine, so this is what the capsules are saying, will protect the probiotic so it gets to the large intestine. Large intestine is 5 feet. It absorbs minimal calories and nutrients, and virtually nothing happens there from an immune perspective. Whereas in the small intestine, where you want the capsules to open up, this is 22 feet in length. This absorbs 90 to 95% of calories and nutrition. It's where leaky gut occurs, and that meta-analysis we discussed a moment ago found that probiotics can rectify leaky gut in the small intestine. It's where you have the greatest density of immune cells. It's the most immunoactive because of that, and it has the most gut receptors. And to quote, it is important to note that we can live without a colon or a large intestine, but not without a small intestine. So again, while I think it was an understandable hypothesis to say protect the probiotic from acid, that's not what we want. We want them to open up right after the stomach in the small intestine. We don't want the probiotics to only open up in the large intestine because leaky gut occurs in the small intestine. This is probably where the predominance of the benefit of the probiotics comes from. So then, what do? It's important to bear in mind adjustment reaction versus a true intolerance. Adjustment reactions usually go away after a few days to a week. By the way, caveats apply here. Always check this with your healthcare provider, your doctor, but this is my general observation. I tell patients in our consulting practice, don't jump ship too quickly. Of course, if the reaction is severe, stop. But if there's mild to moderate turbulence, give that a few days up to a week. And if you see the reactions fade away, that tells you it was an adjustment reaction and you should experience benefit on the other side. Again, up to a week. If a reaction lasts beyond a week, then we probably need to allow a few months of healing and improvement of tolerance before we retrial a probiotic. Now, we also discussed different types, and this is where we've developed this schematic. Probiotics, if you take a big picture view, break down to 3 types. We discuss Mechnikov and the Lactobacillus bulgaricus in the mountain towns of Bulgaria drinking the fermented milk. So this is one type of probiotic, your traditional, oftentimes found in fermented milk, but not exclusively. And these are species of Lactobacillus and Bifidobacterium. Your most traditional form, a blend of Lactobacillus and Bifidobacterium. We also discussed Henry Boulard and his observation that people drinking a fermented tea containing a fungus, Saccharomyces boulardii, had less cholera-induced diarrhea. So this is a different type, your Saccharomyces boulardii. And then thirdly, a more recent addition to the repertoire are soil-based species, Bacillus, Clostridium, Enterococcus, that are found in the soil. So the way that you troubleshoot this is to try these formulas separately. And what this can allow you to do is not shop based upon the name, right? Leaky gut cure, probiotic 7, whatever it is, right? And you can look at the ingredient label and say, oh, this is Saccharomyces boulardii. Oh, this has a number of lactobacillus and bifidobacterium. So now I understand that all of these products can be organized into categories, and I can try, if I'm sensitive, one category at a time. And in my experience, almost everyone can tolerate at least one. So if you have displayed, and if you're watching this, you probably have a history of being reactive, especially to probiotics, try one formula at a time. Now, if you know the formula that you used in the past and had a reaction to, look at the label. Maybe you tried a soil-based, so don't try that again. Maybe you've tried a Saccharomyces, so don't try that again. Maybe you've tried a lactobacillus and bifidobacterium blend, so don't try that again. Try something that you have not yet reacted to. And again, almost everyone in my observation can tolerate at least one of 3. Why this is good news is over time, 2, 3, 4 months, and improvements of symptoms, and therefore improvements of tolerance, you should be able to then add in a second and a third. Now, you don't need to add in a second or a third, but if you wanted to have a strong probiotic, what I think, and this has not been published yet, but in my clinical observation, you will see some people respond to 3 probiotics much better than 1. And I'll put one case study with Phyllis from, Phyllis, hope you're doing okay. This is maybe 5 years ago, where she had not really seen the needle move with diet changes or with probiotics until we got her on all 3 types.
I've been on this particular protocol, I think for now about 6 weeks, and it has 3 different probiotics that Dr. Ruscio had me, introduce in a very, specified way. My body handled those well, and what I've noticed are a couple of things. One is just a general sense of having a calm gut or intestine, and then my energy baseline has increased, and then I'm having better bowel movements and some certain regularity, and it feels more like how I remember my body used to be.
And then from just recently, same concept, Kyle needed ongoing antimicrobial therapy. And when we got him on all 3 probiotics, he was able to get off the antimicrobials and saw the best improvements in his gut health that he's seen to date.
But then when we switched over to the probiotics you have me on, and I don't really understand the differences other than, so you could speak to those if you'd like, the fact that as I was on them, it only took about a week for me to notice, oh my gosh, I don't really have any symptoms. And then when you and I spoke a week or so ago, we were 6 weeks in, like you said, and I think I used the language, like, this is the most normal I've felt in 5-6 years, like
yes.
a normal human being.
So while nothing here has been published, we are hoping to publish this because it's a fairly clear clinical signal that we see. If you're sensitive, try one at a time. Most people will tolerate one, and then attempt over time to work up to all 3. So this begs the next question, how do you dose? This is our evidence-based recommendation. You can go a little bit higher or a little bit lower, but this is sort of the bell curve that you want to be in. For the lactobifido blend, 10 billion per day for 2 to 3 months. You can go higher, but this is where we're moving towards. Saccharomyces boulardii, 10 to 15 billion per day, 2 to 3 months. Soil-based probiotics, 2 to 6 billion per day for 2 to 3 months. Again, remember to check the prebiotic content. Usually, if there is a significant amount of prebiotic, it will be listed on the ingredient label. So that's just something to bear in mind. And again, 3 to 5 grams is okay. You don't want to be above that. And then the final point here, or the final 2 points really, quality assurance. You want to look for good manufacturing practices, GMP, free of allergens like egg and dairy. Third-party testing can be helpful also to ensure viability. And then the last point I want to leave you with here is be wary that the cheapest probiotic isn't always the best value. And this was a pretty insightful exercise for me to go through from a piece we put together a few months back comparing the probiotic that we use, which is anywhere between $49 and $44. And then we went over to Amazon. We found similar ingredient formulas for $15 and for $24. And I said to myself, that's a big price delta. How do we account for that? Well, when you price it out, when you price out the dose per capsule and how many bottles you would need to have a clinical dose, let's say 10 billion for 2 months. With the formula we use, 1 bottle would last you 2 months. With these other 2 formulas, you would need 5 bottles to last 2 months. And the cost, as you see, goes from $49 for the product that we use to $120 to $75. This isn't to say our formula is the best, but what it is to say is, especially for online retailers, they know that consumers like to spend less money, $15, $20, $49. But what you should do is look at how many servings you get for the cost. Because in this case, even though these other probiotics are cheaper, $15, $20, you get much, much less serving per bottle. Therefore, you'll end up spending more money over time. So just something to be aware of. Now, as a counterpoint, you could argue, well, if I'm looking to assess tolerance, maybe I want the cheaper formula. I think that's reasonable. Also bear in mind that sometimes, not always, the cheaper formulas have cut corners of quality. Again, that's not always, and sometimes supplement companies will use spin, kind of the most expensive is the best, and that's also incorrect. So I think if you look for a probiotic in the middle of the pack and you price check, you'll probably find a pretty good formula. So in recap, probiotics are one of the best supports for your gut with a long history of use. Reactions are rare, but they do occur. And remember, sometimes the reactions are coming from somewhere else, and we've talked about how you can circumvent them by understanding the 3 categorical types and looking for a reduction of reactants or allergens. Also bear in mind that tolerance, like with many things, food, probiotics, supplements, improves over time. So reassess and try other formulas as your gut health improves, as your symptoms reduce. Be wary of misconceptions that can scare you away from using probiotics. Check this information with your doctor or with your healthcare provider, but also remember that not all doctors and healthcare providers are equally educated here. So be your own advocate and share some of this data with your doctor, with your healthcare provider. And okay, this is Dr. Ruscio, and I hope that helps you find a formula that works, because remember, almost everyone, it's been rare that I've seen someone who cannot tolerate any probiotic. And this troubleshooting protocol should help you find one that works, see improvements in your symptoms, see a reduction in reactivity, and then more food and less reactivity over time. All right, guys, talk to you next time.